neurology video series, let's discuss Bell's palsy. Bell's palsy is affection of the seventh cranial nerve of the face, and it's the affection of the facial nerve, that is, which supplies the facial muscles. And when the facial nerve is affected, the muscles of the entire side of the face become affected. So it's the lower part of the face which also can usually gets affected in a stroke, but it's also the eye which cannot close, and the eye and the forehead which cannot be wrinkled. So that's how you can differentiate between a Bell's palsy and stroke, or a facial nerve palsy and a stroke. A stroke would only affect the lower part of the face. The Bell's palsy affects the entire face, which including the forehead and the eye. Now, can a stroke affect the whole face? Yes. If a stroke is below a certain level in the brainstem, it has to be really low in the brainstem though, it can affect the whole face, but it's very rare. Most of the time, stroke just affects the lower part of the face. Now, can there be any other cause of a facial nerve paralysis besides Bell's palsy? Yes, there are other conditions like diabetes, sarcoidosis, Lyme's disease, Guillain-Barré syndrome. Sometimes lesions in the brain can cause facial nerve paralysis as well. But by far, Bell's palsy is the most common. So what is Bell's palsy caused by? It's caused by the herpes simplex virus, typically, and it can happen to anyone, any age, with no real predilection. And the prognosis is usually very good. Patients recover, their facial strength and their face becomes symmetrical again, or equal on both sides and not drooping on one side. Usually it takes about 2 weeks to 6 weeks. Sometimes it can last longer than that, and when that happens, they can be left with facial paralysis for good, that is, permanently. When patient presents with facial paralysis, what we usually do is start antiviral and steroids for 7 to 10 days. And then if they're having residual facial weakness, we can use other modalities of treatment like physical therapy to stimulate the facial nerve, and also acupuncture I've also tried in these situations. MRI of the brain can be done to see if there's anything else going on affecting the facial nerve as well. And also eye care should be done, because the person's eye can be very dry. Even though they complain it's watering, their eye can become very dry, causing corneal ulceration. So the eye must be kept moist using lubricant eye drops, and also eye ointment at night, using an eye patch as well.